Does the back of your knee feel stiff or tight when you first stand up from sitting or stand up from a deep squat? If so, this video is for you. I'll explain some common causes of back of knee tightness, plus some easy tips that you can use to start relieving it right away. But before we get into the tips, you first need to understand a little bit about knee joint mechanics. When you're sitting with your knees bent for a long period of time, or when you're in a deep squat, that puts the tissues in the back of your knee on slack. That includes the knee joint capsule in the back of the knee, the calf muscles, particularly the gastrocnemius, the hamstring muscles, and a little tiny muscle in the back of your knee known as the popliteus. Now, when your knee moves from a straightened position to a bent position, the knee needs to internally rotate or move like that a little bit in order to unlock the knee. Then when you go to stand back up, as you get to a fully straightened position, the tibia or lower leg bone has to externally rotate just a little bit. And if the inner calves, the inner hamstrings, and the popliteus have gotten stiff or tight, it can keep that knee in an internally rotated position and make it feel like you have difficulty fully straightening the knee if you can't get the tibia back out into external rotation. So first we're going to work on a few soft tissue techniques to loosen up the inner calves and inner hamstrings. One really effective way to do this is just to pinch with your fingers in the calf muscles. And it's usually this inner gastrocnemius muscle right on the inside of the calf that gets tight. Most people have at least some knots back here, but you may find some ones that are really stiff and sore or tender to touch on. So strum kind of like this between your thumb and index finger, or thumb, index, and middle fingers, kind of like a stroking motion across the calf muscle like this. It helps not to have the calf on the floor because you can have a little more slack in the muscle when it's up in the air. Or you can cross it over like this and just strum across that muscle until you find some really sore, tender, knotted areas, and then just hold a little bit of a pressure on there. Now it does take some time, so when you find one of those sore or tight trigger points, hold pressure on it for 1.5 to 3 minutes. Now one thing that can also help is doing an active release, which means using the muscle as you're holding the pressure on it. And so you find that trigger point, pin it down, and then pump your ankle back and forth. That will help to release the trigger point in the inner calf. Now you can use the same sort of technique on the inner hamstrings, particularly the semitendinosus, which comes around the inner side of the knee here. So if you strum through the back of the hamstring here, right on the inside of the leg, often you'll find a knot right about in this area here on the back inside of the knee. And once you find that area, again, hold a gentle pressure on it for 1.5 to 3 minutes, or you can do some bending and straightening of the knee like that while pinching down on it to do more of an active release technique. Now additionally, there's a muscle in the back of the knee that unlocks the knee called the popliteus. Its function when moving from straightening to bending is to turn the knee inwards. But if you've been sitting with your knee bent and the tibia internally rotated for a long period of time, that popliteus muscle can get tight, and then you can have trouble when you go to stand back up. To help with this, you can just apply a gentle pressure with your fingers right in the back of the knee or the popliteal fossa, and then hold a gentle pressure there. You can also use a rolled up towel in the back of the knee as a way to apply pressure to the popliteus. This also helps if you have knee arthritis, if you have some swelling, because that swelling can collect in the back capsule of the knee. And when you put this towel in here, it kind of pushes that swelling back out of the back part of the capsule and allows you to bend the knee a little bit further. Hold this position for a few seconds or a few minutes and then straighten back out. Now, you can also use this towel to stretch. Again, the calf and hamstring muscles get stiff and tight, And we just released the muscles, but now we want to lengthen the muscles, stretch them out after they've been in a shortened position for a long period of time. One great way to do this is using the towel, putting it around the bottom of your foot, and then leaning forward slightly like this. Make sure you can see it, leaning forward slightly like this. This puts your hamstring muscle on length. It also puts your calf muscle on length. So this stretches both your hamstrings and your calves at the same time. And don't forget that your sciatic nerve also runs behind the knee, so it also helps to stretch your sciatic nerve. Now, when you sit in a position like this, you can do a passive stretch. You can also kind of turn inwards and outwards on the towel, so kind of pulling on one end, pulling on the other end, and finding the part where you feel the best stretch on the calf muscle. You can also do kind of an ankle pump back and forth using some resistance to get your calf muscles activated. This is also kind of a sciatic nerve glide, so it gets your sciatic nerve moving back and forth through your calves and your hamstrings. Now, after you've done that, you can do some internal and external rotation of your tibia. That helps to loosen up the popliteus, particularly in the part where you go outwards. Again, the popliteus is an internal rotator of the tibia, so to stretch it, you'd go into an outward rotation. Now, this becomes particularly important when you go to stand up, and particularly if you get to about here and it feels like your knees just don't want to straighten out or lock out fully. It's good when you're standing up to keep the knees slightly turned out like that to prevent your knees from caving in. That makes you strong as you're going to stand up. But when you get to this fully upright position, you do want to allow the knee to kind of come inwards like that. So the femur is internally rotating at the end range of knee extension. That externally rotates the lower leg and allows you to lock out the knee. So if you feel like you're having trouble where your knees won't fully straighten up for the first few steps, do that little internal rotation of the femur, which externally rotates the tibia, and then do that before you start walking. Now, additionally, you can stretch your calves just by taking a little step like this, leaning forwards, keeping your heel driven down into the floor, and that'll also stretch the back part of your calves before you go to start walking. So hopefully you did find this helpful. Try the tips out for yourself and let me know in the comments which ones you like best. And for more knee pain relief tips, check out this playlist over here. But before you go, if you found this one helpful, make sure to give it a like. And if you haven't already, subscribe to the channel so you don't miss out on my future tips. Thanks for watching, and I'll see you in the next one.